Hello, and welcome to another episode of Cut to It, the Nurse Podcast, for all things nursing that we hope you will learn with the best evidence practice we're going to bring to you. I'm Dr. Rosemary Babo. I am an OR nurse, and I worked in medical affairs and global clinical education, and I'm here with my partner in crime.
Marianne Sanford. That's a little tease about what we're going to talk about today. I'm also a registered nurse, operating room nurse, and medical affairs professional. Thanks so much for joining. We really appreciate you.
So, this episode is on the hidden clue in OR2. What does that mean? I don't know. Do all nurses know about forensic evidence and what they need to do to secure what they are gathering in the OR, as well as the integrity for the patient for upcoming litigation, perhaps?
Yeah,
What
I
does the
can tell you.
literature show us?
Oh, so I could tell you just from professional experience that my facility was not used to those kind of cases, and I myself had two. So that just tells you how rare it really was my career. And clearly, we knew nothing about what to capture. It was a lot of guesswork, and I'm hoping that never affected the cases that were as a result of those two incidents. But the literature talks about it really isn't a good, people don't really have good practice for this. In fact, there was a study 2025, fairly recently. Oksan was the author, and it was healthcare provider knowledge level regarding forensic cases in the ICU as well as the OR. And just for the record, what is a forensic case, just in case you may not know? It's a case with a firearm injury or a slashing or stabbing incident, occupational accidents and burns, also traffic accidents. So it actually is a pretty wide range of what a forensic case is. So what they did was they actually had a survey of the staff in the ICU and the OR, all the staff, by the way, not just the nurses. And what they found was that in collecting this evidence, it was very rare that the healthcare provider staff would know what evidence was. They wouldn't know what evidence was. They wouldn't know how to track it and what kind of recording needed to be done to be an official document other than the OR document. And a lot of the forensic evidence actually was overlooked, which didn't help the prosecution or the defense or whatever in these cases. There is an emphasis in the literature about the lack of knowledge. So it's not just anecdotal, like I'm talking about my limited experience with forensics, but the fact that it is a very important topic, and the knowledge base has to be improved. By the way, just to give you some perspective, most of the previous studies on this topic were about the ER staff. Okay, so the ER staff, yes, of course, that's the first encounter typically when it's a healthcare system, somebody's entering the healthcare system. And they also would be doing some evidence collection, but it turns out that they actually know better because it's more common for them. Not everybody ends up in the operating room. Some people go directly to ICU or a floor or whatever. So they're more apt to know what to do when it comes to forensic knowledge. In that study, there were 116 participants, not a huge number, but fairly large. And it was OR nurses, ICU nurses, surgeons, and anesthesia. So it was quite a wide range of everybody. And it was interesting because only 62% of all those roles in the operating room and ICU actually had retained training on forensics. So that's in this study, actually, that was a really above average result. So it was sort of interesting that they had a high result. But 84% of the nurses encountered forensic cases. So there's a very wide gap between people who are involved in a forensic case and those who had training for it.
Yeah, that brings up a really good point, Marianne, because I worked in a level one trauma hospital and I don't remember ever getting that in my LMS as a annual check box, you know? It is very important to make sure that everyone has that training.
Yeah. And
I think annually, honestly, because as things get updated and in terms of quality and what we know about the testing, and also the other thing too is even though we're primarily operating room nurses, I think too that there's a real chance for ER nurses to have, some clothing disposed of. You're in a rush, especially if it's a bad trauma situation, um, to really remind people about what the process is and to review it, because that can make a real difference in somebody's life if you miss something. I had one time that they came in, and because of an astute nurse that was working on this victim that came in, noticed a cut in the shirt, even though that they had, with
oh,
the trauma shears had pulled off, and they knew that there was an abdominal knife wound, but the one on the shirt sleeve was missed. But she happened to see it, and she carefully, protected the garments and stored them properly. And so when the suspect was saying, "Oh, it was self-defense. It was, broken bottle, and I was, just trying to defend myself," that it actually came up with, well, no, there was a knife that they found, and it matched the materials, were still able to be pulled off of what was injected into, injected as a wound into the skin, and they were able to match that up. And if she had not noticed that, because it was all bloody, and they cut it off, and they could have disposed of it because they knew that the abdomen, no, it was her astuteness that really made a difference in that person's life. So ER, and then as we go into the OR with some of what you're talking about, that you really have to, as you're extracting things from the wound there, proper handling.
I can tell you in the very, like I said, very limited, in limited cases that I was involved in, we weren't I mean, you get a patient in the operating room, you maintain their dignity, right? You work on just the part of their body that you're needing to work on. You're not checking their whole body for supplemental injuries, and so that's why it's probably very important to catch that in the ER, and then but we shouldn't maybe make an assumption that everything has been caught, right?
Right.
So I don't know how I feel about that. The OR nurses looking for things, or the OR staff looking for things, but it is something to consider, and maybe that would be part of the training, whether the operating room needs to do that. The other thing is evidence preservation. So in the cases I was involved in, they were both gunshot wounds, which were very rare by where I lived at the time. And I remember the one surgeon, you know, it's kind of amazing how people approach this, right? We did find the evidence, the ballistic evidence. It was a bullet, right? So we did find that, and I remember the surgeon asking me for the emesis basin because he wanted to take that bullet and throw it into the emesis basin, and we were all like, "No, you can't do that!" Like just to hear the clink of it, right? So everybody at least knew that would be wrong because by doing that, you're affecting like the what do they call that? I'm not a firearms expert. The markings of the bullet, that when the bullet comes out of a gun, so you might dent it or you might somehow re-scratch it or whatever. So even then, without training, we knew that was really probably not a good idea, right?
The
And the other
integrity of the evidence, huh?
integrity of and that's exactly the point. Thanks for bringing that up. It's really important for the chain of custody for these whatever you might find, right? It really depends on what you're finding. But that's what this study was talking about, that people, when they would find evidence or see evidence of an injury, either or, there was questions about how to document it. Again, does it go on the OR record? Is there a separate form? Who is in charge of taking that information? Is it the staff in the room, or should another person be brought in that maybe has a higher level of training? This study elicited those facts that these people really had no idea who was, in most cases, had no idea who was in charge of that kind of information. And that can be really critical when you think about it. I mean, also in the care of the patient to write down so that there's legal documentation for their own purposes, but then of course purposes outside the operating room and with the litigators, right, the district attorney or whatever. In the nurses really wished that there had been more training, right? That was the key thing. We always say training, 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 training. But this
That's
is very
true, though.
specific and targeted training. And when you're training, I don't know, I'm kind of thinking that there's a difference between what you're talking about, a level one trauma center, and a independent, non-teaching community hospital where I was practicing. And I think that those probably should be similar in most ways, but maybe more intense for the people that are at a level one trauma center because they would see it more. And maybe you do need it more at a community hospital. I'm not really sure, but having never had the training, I'd be interested to know what our listeners have had. And if they could let us know,
Yeah.
we'd love to talk about it further.
Yeah, certainly interesting stuff. And, I don't know how many people even really considered that burns were subject to forensic, I guess, what do you, gathering because of the burn. And I guess depends on what kind of burn it is, too. So I
Yeah, and
found
the
that
location.
interesting.
Yeah, the location also, like in an odd place for the history that you know about the patient, what extensive, I mean, we always record how extensive it is, but I think the location and the pattern could be very important, right? And that's especially true in the ER anyway for children. Like there's certain patterns of burns that indicate child abuse. So that would be an important forensic piece of information for someone to document. The OR record, which is really protected, or is it a separate document? This is something that needs to be trained.
Well, I think you brought up a lot of really good points, and what role does the operating room staff play in searching a patient's body to find additional and maybe not, you know, we always are taught treat, even if it's gushing, you have to find the most severe and life-threatening injury first. But how much time is allotted? Are things missed? Everybody is human, but it is something to really pay attention to, I think, when you do have somebody that comes in with one of these most unfortunate events, to really do a thorough search. There's a TV show right now on called The Pit, which is a very
Mm.
popular and I think really representative of what goes on in the ER. And I'm glad that they do show that, they're treating the one thing and then, they happen to move the patient and find out there's something else that really needs attention. So I do think that it is a good reminder for us all not to just overlook things and really be mindful of what's going on because it can, even from the storage of what you're gathering, emesis basin, but not a plastic bag either. You that can promote mold and bacteria growth and really affect the integrity of the evidence. If you're putting in a specimen container, put some gauze in there as well, just to protect what's any of the fibers or anything that's around it. So there's a lot of things that I think we can benefit from, not only looking at the evidence, but also as training. And, even if you're in a smaller hospital that's not a teaching hospital, I think it's very valuable to have this information as caregivers.
So, if we talk about training, one of the recommendations from this study was, of course, increasing training. But it was interesting who they thought should do the training. Law enforcement, right? Law enforcement would be very key into that initial reaction of how they would preserve evidence, not maybe not collect, but preserve. From prosecutors. Now, the prosecutors are really critical to help you understand what should be preserved
Yeah.
and how you might approach looking for multiple things in a patient. And perhaps that's more ER focused initially, but when they do come to the operating room, that would be very important. And also from the legal department in the hospital. So to understand what is your responsibility, how are you covered by the hospital if perhaps somebody comes back and says this isn't the way it was supposed to be done, even though you might have had training. And it was also very critical in the study. They outlined one of the most important things beyond training is also to determine, to have somebody who's in charge by a standard operating procedure, an SOP, and define that, what the roles are, who's going to be in charge, who is going to be taking the record, where the record will be. It's really critical and to think about these things, obviously, ahead of time. But I know, and I could tell you just based on the results of this study, that a lot of hospitals, a lot of care centers, and around the world, by the way, this study was not done in the United States, to have that training, because clearly it's not happening. If so many people are exposed to cases, like 82% of that 116 were exposed, but only 64% knew what to do. I mean, that's almost half. It's really not a good situation. So we have to resolve that through training and SOPs.
And I think I never, that I can remember, had a guest speaker from risk management. And I think that is so important. And maybe that's something else somebody can do as a quality improvement project, or even add it into, any of the safety councils that they are involved in, because nobody wants to be involved in litigation and thinking, oh my gosh, now I'm the subject of a lawsuit and deposition. It's just morally just hurtful to you, and it's hard to do your job when you think this is hanging over you. So that would be something I really think would be valuable to have, even quarterly. Just let them know, this is our process, this is the training that we're doing, this is why it's so important, and why we work together for the benefit of the patient, as well as the hospital or ASC, or even doctors' offices. This is what's needed to keep us all safe. So great points, Marianne. Well,
Yeah, thank you. I thought it was very interesting, especially since I hadn't really been exposed to it a lot. But it was a good topic to talk about, since it's really something that's not on a lot of people's radar for many different reasons, and some quality improvement ideas that we brought to light today. Hopefully they're, I say in my
ideas,
best
yeah.
New Jersey accent, ideas.
I,
But it's
I
a
love
it's a
it.
good thing to have this discussion, and perhaps our listeners will go ahead and have those discussions internally, and foster good procedures to make sure that nothing is missed and we don't miss that clue in OR2.
Yes, for sure. So thanks for tuning in to this episode of The Hidden Clue in OR2. Please like, subscribe, email us, let us know what's on your mind and what you'd like us to cover. Until next time, see you.
Thanks so much for joining Cut to It. Take care.